So again, welcome everyone, and looking forward to sharing our recognition program with you all and how, again, this is a call to action. So just some logistics and housekeeping, excuse me. Please make sure you're muted during the presentation. There will be a chance at the end to come off mute and interact with us, but during the presentation, we ask that you stay muted. And if you have any questions, feel free to put them in the chat. We will be going back through the chat and reviewing some of those questions. So feel free to put those in there as you think of things and as questions arise. So today's presenters include myself, Karan Phillips. I am the Policy Development Manager at Trust for America's Health, and I work alongside Megan Wolf, our other presenter, on the Age-Friendly Public Health Systems Initiative. And we're also pleased to welcome Chuck Henry with the Florida Department of Health in Sarasota County, and he will be sharing some personal experiences, his insight with the recognition program. So to set our context for today, when we think about healthy aging, we have to understand what really is embodied with the idea of healthy aging. And if we go back to the Rowe and Kahn definition, this is what is embodied in this image here, and that the key components of healthy aging involve the promotion of health, preventing injury, and managing chronic conditions. So that's the first part. Optimizing physical, cognitive, and mental health. That's the second part. And then being able to facilitate ways to engage in social activities and eliminate social isolation. So these, again, all three that bring together the intersection of what healthy aging is at its core. And we have to note the impact of the pandemic on the health of older adults. And it impacted older adults across the world, as we can see here. Many of them had to cancel appointments or postpone them because of the pandemic. And as you will note here, the US had the highest percentage of canceled appointments at 37%. And in addition to even appointments, think about the disruption on daily activities and daily interactions. So during the pandemic, many services and resources were unable to be provided to older adults, leaving many older adults without support to complete their daily routines. And the US, along with the UK and Canada and Australia, were most likely to experience this phenomenon during the pandemic. Now I turn over to Megan.
Thanks, Karan. Yeah, some of those statistics are really startling, and the impact of the pandemic on older adults, and particularly those who are most vulnerable, living in nursing homes and assisted living facilities, has really been drastic. But even before COVID, public health in general has really not had a strong overall focus on older adults, other than the more disease-specific interventions that, as Karan has pointed out, COVID has really shined a light on the complexities of ensuring older adults' needs are being met. And one of the most severe consequences was from the stay-at-home and quarantine requirements, which really exacerbated social isolation. But public health collaboration with home-based care agencies, aging services, emergency medical services, and health systems did enable a more effective targeting of engagement efforts with older adults, and really help to also kind of spur new partnerships and new collaborations and coordination with other community-based services. So, public health agencies can also provide preventive services, including screening. They could even screen for social isolation, help ensure access to nutritious food, and a lot of that is done in partnership with aging services like Meals on Wheels. They can provide physical activity and balance classes, and a lot of that shifted during the pandemic to virtual sessions, and work within the community to expand options for transportation and housing. So go to the next slide, please, if you will. So based on the recognition that public health can expand practice to address older adult needs, TIFA has partnered with the Johnny Hartford Foundation and others to develop a framework for creating age-friendly public health systems that we hope elevates healthy aging as a core public health function. That's our goal, that's our vision, that healthy aging would become a core function. Our framework is focused on the 5 key categories or roles for public health, which we call the 5 C's framework. And we're thinking about a 6th C, so stay tuned for that. So just briefly, the top one is connecting and convening multi-sector stakeholders to address health and social challenges through collective impact. The second one, coordinating, refers to bringing together and coordinating the existing services and supports to help older adults, their families, and caregivers navigate that kind of wide variety and often confusing litany of programs that are available in the community. Collecting in the green box refers to collecting relevant data on older adults to call attention to the needs and assets of the community and help to inform the development of potential interventions. Communicating, a big role for public health, and it's very important to be able to communicate information that can empower the public, which can then mobilize new partnerships to work together to solve health issues. And then finally, complementing refers to the complementing as well as potentially supplementing existing health promoting programs and services to ensure that they're adequately meeting the needs of older adults. Next slide, please. So as you can see on the figure on the left there, there are a lot of activities within the 5 C's framework that can align with the 10 essential public health services. So Karan, if you'll click forward, because I've got some arrows coming here. So one of them includes, as I just mentioned, collecting and assessing data. And that is definitely a big role within the public health 10 essential roles. And the next arrow is communicating and creating messaging for the public and for key partners. And then the last one is creating key partnerships. And that's one of the things that we have learned is one of the most crucial roles for public health, but also helps to leverage limited resources and capacity when groups and organizations and agencies and stakeholders can all come together to join and address healthy aging. So next slide, and I think it goes back to you, Karan.
The one key thing that is also highly related to this idea of healthy aging is that it requires a life course perspective and a life course approach. And the idea of the life course is basically our unique path of development that people take throughout varied environments as well as their varied life experiences from the crib to all the way through older age. And this framework is more dynamic because it links both social and psychological perspectives into this concept. So again, thinking about how can we start to approach healthy aging, but starting even earlier and starting across the whole lifespan so that when we reach older age, we are aging in a healthy manner. And we recognize that many health departments are well underway to becoming age-friendly, and they're engaged in many activities that support older adults to promote healthy aging. But we want to further incentivize these efforts, and TIFA designed steps that are key to making the transformation to being healthy, to being in age-friendly and supporting healthy aging in these departments. So these are our 10 steps, and I will briefly go through them, but we will also talk about them a little bit further along in the training. But again, they match a lot of our 5 C's that Megan went through. And again, the goal is to not only highlight, but to promote collaboration and other enhancement of programming. So the first, and these are not in order that they have to be completed, but these are in the order that we have them. The first is having access to data, collecting, analyzing and disseminating that information so that people will understand not only what the health needs of older adults are, but what are the health profiles of older adults in your communities. Making sure that older adults are engaged in the conversation and having an older adult voice in these conversations about health in the community, making sure that their needs and desires are reflected. Partnerships, again, getting at the need to have partners to help serve older adults, figuring out ways to collaborate, but not only that, to complement what is already happening in communities. Leadership, we call it an aging champion, but having someone that is the aging lead in the health department. Reviewing existing programs. So taking a look at what is already happening in your various departments and thinking about how are these programs serving older adults, how they may be then in step 6, adapted to serve the needs of older adults. So reviewing and then subsequently adapting. 7 is emergency preparedness. Ensuring that emergency preparedness planning not only includes older adults, but their caregivers as well. And 8 is attending our training, as you all are doing today. And we have them on the 3rd Thursday of every month. The 9th step is supporting the larger age-friendly initiatives, including the AARP, World Health Organization, age-friendly communities and cities. And finally, engaging with age-friendly health systems. And we have age-friendly health systems, we have geriatric EDs, we have even age-friendly nursing homes. So again, connecting with those initiatives as well to continuing to be a part of the age-friendly work. So getting started, it does not require any additional funding. That is the wonderful thing about this program. You don't need to seek out any additional funding or opportunities to get started. And again, if we go back to those steps, some of those things are already happening, and it takes time to review and consider what is already being done and what can be adjusted to include older adults in those efforts. And it does not often require additional staff. The aging lead or the aging champion can be someone already on the staff that is willing and empowered to do this work and to support older adults. Turning it back over to Megan.
It would help if I unmuted. Thank you, Karan. You know, the recognition program, enrollment is easy. The steps were designed to hopefully be things that some of you are already doing within your agencies, and hopefully, you know, things that you would think about doing anyway if you were going to expand your role in healthy aging. So we just wanted to provide you an example of 3 of these action steps, because we do part of the recognition program is a requirement to demonstrate achievement, or that you've actually taken action in those 10 areas. So these next 3 slides are designed to show you how you can provide that evidence of action. So this first one is about data. So this is a page out of the Florida Department of Health in Walton County, their community health assessment 2019. And you can see that they took some of the data from the Florida Aging in Florida profiles on the online platform in the state of Florida to include in their community health assessment. And a lot of the county health departments in Florida are doing that. We understand not every state has the kind of data that that is available in states like Massachusetts and Florida and others, but it is definitely something to work toward, and we're happy to help you as well to take that step and move in that direction. Next slide, please. So Karan mentioned that collaboration is another really important aspect or role for public health, and is one of the steps in the recognition program. So this example is again from Florida, from Miami-Dade County, where the county health department there leads the consortium for a healthier Miami-Dade. And this consortium has an elder issues committee that helps to coordinate other healthy aging activities, contributes to the community health improvement plan, and so forth. So this was something that Miami-Dade was already doing before we came to Florida and initiated our pilot project there. So all that to say, there may be activities that you're already engaged in that can count toward action on the recognition program. And by the way, we really feel like recognition has a lot of value for health departments, whether at the state or local level. It can help with funders. It can help with the public. It can help, with your leadership in your jurisdiction as well, to show that you're taking action and really trying to address the needs of the entire population. And next slide, please. And then finally, the third example here is about assessment. So looking at and reviewing the programs that you already have within your jurisdiction and seeing if they touch on older adults, whether intentionally or just as a matter of course and as a matter of practice. So what you see on the slide here is a page out of the Denver Regional Council of Governments Boomer Bond Assessment Tool. It's a mouthful, I know. But this is a tool that provides really kind of a mapping out of assessing programs across agencies in your jurisdiction. So it can be a really helpful tool. We're happy to share that with you all, but there are lots of other ways to look at your programs. When we get to talking with Chuck here in just a few minutes, he may even have some further ideas or can give you some examples of how they were able to accomplish that step in Sarasota County. So next slide, and I think that's the end of our examples. And back to Karan.
Thank you, Megan. So you're here today, and this is our monthly training. And these trainings are designed to help build expertise in healthy aging, provide some peer learning. We, again, are sharing information, but we also encourage you all to share information as well. We encourage you to put information and resources in the chat as well. And they occur every third Thursday at 3 p.m. Eastern Standard Time. And we are in the process of planning for 2022, but just to reflect on 2021, we addressed combating ageism, improving health equity, social isolation, housing, COVID-19, and looking at even vaccine hesitancy and vaccinating homebound individuals, emergency preparedness, dementia, and caregiving. And for 2022, we will start off January by revisiting, we're calling it a ageism course 2.0. We're going to revisit that topic in January, but the rest of the year we'll focus on the social determinants of health. So we will be sharing those trainings soon with you all. So look for that schedule as well. It will still be on the third Thursday at 3 p.m. So you can go ahead and mark your calendars. We will keep that same time and schedule. Oops. So one of the ways that we hope to support and help you all as you consider and as you work towards making healthy aging a core function and completing the recognition program steps is to provide some additional technical assistance. We will meet with you one-on-one. If you need any support, any guidance, we are happy to schedule any one-on-one sessions to walk through the steps, ask you questions, and we'll also work as best we can to connect you with other people in your state that may be doing work that may be helpful to your program. We're starting to do a new format where we will actually, some of you, we will reach out and fill out the form for you. And if we know that you are enrolled and engaged in the program, we can start the form for you. We know you attended the trainings. If we already know you may be engaged in certain partnerships or you already have data profiles, we will fill out the form for you, share it for your review. We won't finalize it for you, obviously, but we will share it for your review in hopes and that will help you feel comfortable in finalizing the other steps, and then we can get you recognized. And then we will celebrate your recognition. We have recently, we are acknowledging all of our recognized, we have one state and one county at this point, but we will recognize it, share it all over our social media. Our partners will also share it as well. So we want to make sure that you're celebrated and recognized for this tremendous and critical achievement. So with that, we're going to move on to our next part of the training. I'm actually going to call this for short a chat with Chuck, but we're pleased to have Chuck Henry. He's the health officer with the Department of Health in Sarasota. So he and Megan will engage in a conversation about his experience with the recognition program. And again, we'll open up for questions. So feel free to start putting them in the chat if you have any, and for Chuck or for us or Anyway, so I will turn it over to Megan and Chuck.
Great, thanks, Karan. And let's take the slides down at this point. I think we can have an opportunity to just see each other. So if you have a question or a comment as we're going along, please, if you feel comfortable, show your video and unmute yourself and ask a question. So Chuck, my first question for you is, because Sarasota County has been engaged in healthy aging for a while, well before TIFA came to Florida and began to work with the Department of Health there and the county health departments. So I'm curious what you think of the 10 steps of the recognition program. Do you think that that if a health department does take action on those 10 steps, that is kind of a way to that they will be considered and they can be, sustain this healthy aging work?
Absolutely. I think it's probably a lot easier than most of us want to believe. We tend to overcomplicate things. So, I've shared with you, but I'm happy to share with everyone else that we found the recognition, the 10 steps, really valuable to us in terms of, I call it defining the why. Because everything I do has to be looked at through that lens in this time of limited resources. Why do I choose to do the things I do? Part of that's easy for me in that 37% of my community is above the age of 65. I have about 160,000 citizens in that group in my county. And so that's why we've been working in this area for quite a long while, because it just made sense. But still, we fight for resources sometimes, or have limited staff time. So deciding where we spend the staff resource, this process really helped us as we were documenting the evidence of each of those steps. It helped remind us just why this was so important, and also gave us those sound bites that we can use for those elevator speeches with the various funding streams that we have as those come up, because they're all front of the mind now. We know why we do this work and why it's important to our community.
Awesome. I love that. Being able to define the why is so important. So tell me a little bit more about, in terms of, you mentioned data. And so I wanted, if you could tell me a little bit more about the importance of collecting data. Well, you didn't mention data. You talked about your population of older adults, and why is that so important?
Well, I think it's important in anything we do in public health today to understand the data behind what we're doing. And again, part of that comes back from my perspective to validating why we're spending resources, whether it's money or staff time on a particular issue, really should be supported by data that says there's a need for that. Data is critical in helping identify what the needs of your specific community are, because every community is different, in terms of the challenges they face and the demographics that are there. And so understanding what those are helps provide better insight and where you can be most impactful for your community, regardless of what age group you're focused on. And, Karan and Megan know we say community for all ages here. We have discovered over the years that every effort we make in the age-friendly arena benefits our entire community in one way or another. So it really improves quality of life for the whole community and really makes it an easy sell.
That's so cool. And we agree. Could you give us an example of an action or activity or a change that you implemented that was originally designed for older adults, but then ended up benefiting the whole community?
Well, probably the example I like to talk about the most is our county Parks and Rec department implemented these items called Moby Mats. I first have to tell the community, if you're not familiar with Sarasota, we're on the west coast of Florida, about an hour south of Tampa. We have 34 miles of beautiful Gulf of Mexico beaches, and some of the prettiest beaches in Florida. We're biased though. But one of the problems is the beaches are pretty expansive. And so older adults with mobility issues sometimes had real difficulties getting down to the water to enjoy those amenities. So these Moby Mats are these big, wide I say plastic, it's not really plastic. I don't know what material they're made out of, but they roll it out across the beach and it provides a hard surface so that people can, with wheelchairs, can easily get down to the waterfront without having to use the big bubble tire chairs and enjoy the amenities. And so we initially envisioned putting one of those out as a way to serve our elder community. We now have 3 of them out across the community, and we're hoping to put more out. But what we quickly discovered is they're used by moms with strollers. They're used by young adults with wheelbarrow full of stuff they're just hauling down to the beach to enjoy. They're used by our elder adults. So essentially they improve quality of life for the whole community.
I love that. And I actually do have a picture of that, which I can't bring up right now, but I would love to share that at some point with the group. So I have a few more questions, but I want to see if anyone else, any of the attendees here has a question for us or for Chuck about the program. And one other thing that I will say is that there's no hard time frame to accomplish the steps to achieve recognition, although we think that the steps can all be reported on and accomplished within 2 years. Chuck, about how long did it take you all once you enrolled in the program to achieve the recognition?
Gosh, I think we enrolled about 8 months ago,
Mhm.
and I think we probably had everything already the day we enrolled. We just, like everyone else, probably were busy with COVID, and it took a little bit of time to carve out the time to fill out the form and be comfortable that we were actually answering all the questions and providing the documentation required. So, but I thought it was pretty simple. It was very straightforward, and my recommendation to everyone is stick with what you know best. We all know public health, and as you begin applying that elder lens to your work, it's very easy to see how everything aligns pretty quickly with the 10 steps. And so then you just state what those are and document it and send it up. And if it's not what Karan's looking for, she'll let you know. But I think it's pretty straightforward.
Great. And there was a question about enrollment. Karan, you want to address that enrollment question? How do you enroll?
Absolutely. I was actually typing it in the chat too, but I'll finish that up too. Simply send an email to AFPHS@tifa.org and just say, hey, I want to enroll. And it's that simple, and we will take it from there. We will likely reach out. Well, we will reach out, and then we will ask you if you want to have a one-on-one meeting, which we find it very helpful because we can already encourage people to just share what they're doing. And by the time when we're done with these meetings, most people are done with about 5 steps. That's just a general average, but it could be more, it could be a little less, but we do find that it's comforting because people can already say, oh, we've done half of these, or we're doing that, or oh, we have to do one more thing and we're done with this. So I'm going to put the email address in the chat as well, but it's just send an email to AFPHS@tifa.org.
Right. And we also have guidance on our website at afphs.org on some, a number of different ways that you can actually meet the requirement for each of the 10 steps. And so Marcy, I'll get to you in just a moment, but Christy, you had a question. Do you want to come off mute and ask your question?
Hi, I had a question about number 10. When I looked at the reference sheet, it said that you should be engaging and aligning with hospitals and health systems participating in the age-friendly health systems movement. When I looked up at least the hospital side, I didn't see any within our community. So I was just wondering, what are kind of some alternative ways to meet number 10 if other agencies within your community aren't part of that official movement?
Right. So that has been a challenge for some of the counties and jurisdictions that we're working with, but it's an important step, and we do feel like there are ways to do it. One of the first things you can do, and this would certainly satisfy the requirement, is to reach out to a hospital system, or a nursing home in your community, and start a conversation with how you might begin to work together, perhaps even introduce them to the age-friendly health systems initiative and the 4 M's framework that is based on, because in a lot of cases, I think hospitals and hospital systems want to become age friendly, and maybe they're just not aware. But I think we're seeing more and more of that happening. Jane Carmody from the Johnny Harford Foundation is on. Jane, is there anything that you would like to add about this important way to align and connect?
You know, Megan, I was just quickly trying to find the picture of the Moby Mats because Chuck, we use it all the time, as well as with curb cuts. The same idea. Those were hard won, hard fought to have curb cuts, and look what they've done for every community. It was a good long time to do. You know, Megan, I'm just sitting here thinking that we're so excited about this. And I'll tell you what, I just had a phone call today with the American Hospital Association, and they're so interested and open to working with public health. They say they are, and we want them to, we want to encourage that. And so we'll continue a dialogue about it, especially, of course, Chuck, I think, as you pointed out, in their community benefit area, where they are really supposed to be working with public health to assess as well as to act on those assessments. So Megan, we're all here at the foundation, and every opportunity we have to encourage health systems to work with public health. There is really no other way than doing it this way. So I also want to congratulate Chuck for being the first local site. We're excited about that, and I hope you all will do it. And who could be better help than Karan and Megan? I mean, goodness, you know, and of course, whatever we can do to help as well. And I've been kind of talking a little bit on sub chat with Marcy, because I appreciate all that she's doing, and she's got now 5 sites. And so we're looking forward to what they can do in Washington. I just got off the phone on a webinar with Washington State, and their focus on palliative care and telehealth. So I'm telling you, public health is everywhere and doing great things. And if we can just align them better with public health and the aging sector, which you're already doing, we're excited for that, and we're right behind you, Tifa, in making that happen.
Thank you, Jane, so much.
Did I talk too much? Sorry about that.
No, it's great. Thank you.
We're excited about it.
Always appreciate your insights, Jane. It's really helpful. Chuck, I wonder if you could address how you all accomplished step number 10. That might be enlightening as well.
Step number 10.
It's the age-friendly health system. Hospital system
So,
alignment. Yeah.
Yeah, here in Sarasota, we're very fortunate that we have a very large publicly funded hospital, as well as 3 other hospitals. And our large publicly funded hospital is an age-friendly health system recognized hospital. And so we're already partnering with them on a number of areas, and in our work as an age-friendly community. And so it just made it pretty easy for us to make that connection, because we were already connected, doing a lot of work with them in the area of dementia and Alzheimer's, because they're the lead for us in that area. They're also in a stroke center as well for our community.
Great. Thank you. Marcy, you had a comment or a question?
I just want to comment, which was to folks, is that it really was very, very helpful when I was looking at our recognition to meet with Karan and Megan, because I think it's easy to sometimes overlook the things you are doing that really did count towards it. And so it was just really helpful to talk it through with them, and then to type it up was not difficult either. But I know that Jane already suggested it, and Karan, I think, did too, but I definitely would encourage you to talk it through, because I think sometimes when you see the 10, you think, wow, this is a lot, but I think you'll find that really you're doing a lot of them already, or you can build them in, which will strengthen things for you. That's it.
Yeah. Absolutely. Other questions? Chuck, I wonder, were there any surprises for you as you were kind of looking at the 10 steps and when we were talking about completing the steps? Just wondering if there was anything that kind of jumped out at you.
No, I wouldn't say there were. The surprises I had were listening to all the different suggestions from staff about the different things we could use as evidence of steps, because we were fortunate to have a number of things. But And you know that early on, we began to combine our public health assessment that we do on a regular basis with our agent assessment and our hospital assessments, and did some work there. So most of that work played into several of the steps, in terms of evidence pretty easily, because once you make that commitment to ensure that you hear the voice of your elder community in your assessment, you can't help but collaborate with them and engage with them and get involved in various projects across the community that impact health. So it really all plays well together.
Megan, can I add just a quick note that I thank you, Marcy, because there could not be a better team to help you than Karan and on this, and Megan. But Chuck, every time I hear you talk, the percentage of older people goes up. I think
Yes.
when we first started talking was 32, then it was 33. What did you say today? 37?
37.
Jeez, we're
And we
growing.
expect it to go up probably another 5 or 6 more years before we begin to peak out, and the rest of Florida catches up with us.
So Chuck, just a question about that. Is that because of just the population of your residents, or are you having people move into Sarasota, or is it a combination?
It's a combination, but Sarasota is a huge retirement destination.
Mhm.
I tell people, not only do we have beautiful beaches, but we have all the big arts amenities that a big city has without all of the traffic issues of a big city, although we do have some traffic issues. So it's really a pretty neat place, but we have a large percentage of retirees, which is great on one hand, because we have lots of volunteers that help us do a lot of stuff that bring a lot of knowledge to our community. On the other hand, it can be challenging sometimes because people get in a mindset, I've done my thing, I'm retired now, I'm not interested in contributing to this or that. So you get both sides. And then, one of our data points that we're focusing on moving forward is alcohol consumption. We have a huge social alcohol consumption component to our data. We have more beer, wine, and liquor outlets per capita than most cities in Florida, and consequently, we have a higher percentage of issues around alcohol consumption than most communities. So that's an area we're working on, and that's primarily due to our retired community.
Mhm, mhm. You never know what data is going to show, and and how you can use that data. I know that when we first started this work, Orange County, Florida, was looking at the data of the just prior to 65, so the kind of the 55 to 64 population, and really targeting them for physical activity, so that and it's kind of that life course approach that Karan was talking about earlier, so that they could begin to better support health and physical activity to prevent falls when people got older. So there are a number of different ways of using that data and looking at it.
Yeah, we didn't include it in our recognition program because it's something we're working on now, but we partnered with our senior center and public broadcasting group, and we're co-sponsoring a screening of the movie Fast Forward at our senior centers. We've had one already. We've got some more planned in the near future before Christmas. First one was very well attended. We had about 85 people there. They have refreshments. We talk about why the screening is important. We show the movie, and then we have discussions afterwards about what people's perception was with the movie, and how they can improve their life course from that point forward to be healthier as they age. So it's been really fun to do that.
What a great idea. Wow, that is really interesting and very, very smart. So I'm wondering, Chuck, what when you first started embarking on this healthy aging work and getting involved with age-friendly communities through AARP, what was the biggest challenge that you faced?
In my community, one of the biggest challenge was on the political side a little bit. The downside to being a big retirement community is sometimes there's not a lot for young adults to do or to fit in. And so there's this brain drain. People go off to college and don't come back because it's a place where old folks live. So we're constantly fighting this perception. Don't talk about aging or age friendly because we have enough old people here. We don't need to encourage more to come. But over time, it probably took 4 or 5 years of that work before people began to understand how valuable it was to improving the quality of life for not just older adults, but all families. And so it's pretty broadly accepted now, but that was probably our biggest challenge initially, just that perception.
It's interesting. And I think in a lot of communities, and I think that this, the combating ageism trainings that we do and the work that the Gerontological Society of America is doing and leading the Reframing Aging Initiative is so important because people who are over 60, over 65 do have a lot to offer. There's a lot of wisdom, there's a lot of experience that can really help younger people to improve their lives and to make connections, and that those can be really valuable relationships. So appreciate all that work that you're doing.
And as I noted before, the volunteers that are available to help public health are amazing. And when we were in the heat of our vaccine campaign, at one point, the health department was providing almost 4,000 vaccines a day in the community, and over 60% of the staff doing that were volunteers.
Wow.
That just wanted to be a part and came in and helped, many retired nurses, doctors, et cetera.
That's great. Any other questions about the actual steps in the recognition program, the process? Any issues, any comments of others that may have already enrolled? I know some of you have enrolled. I'm looking at the names here, so. All right. Karan, did you have any other additional comments or questions from your end?
No, I also will be placing in the chat momentarily our monthly blog series that we are highlighting that coincide with our trainings. And this month we again are highlighting the recognition program, but we also feature some quotes that further support our chat with Chuck. So he shares his insight on, again, completing the steps and what they're engaged with in Sarasota. So I will be putting that in the chat. And
thank you. Great, thank you. Chuck, any additional thoughts that you'd like to share?
Well, I put it in the chat box, but just, there's a big network of those of us out here already doing this work. Many of those on the call included. Reach out to each other. We're all excited to share what we're doing and learn new things from each other because it's the easiest way to accomplish things. So.
Great, thank you. Well, thank you for all that you're doing and thank you for being here. So just to reiterate, we at TIFA believe that this is a population, those 65 and over is a population that from COVID really needs and deserves the attention of public health. And we really feel like healthy aging is coming of age, if you will, and is becoming a very important function for public health departments. And we are here to support you. We want to recognize the great work that you're already doing and help you make connections with some additional efforts and partnerships and data and any way that we can support that work. It really is all about improving the health of the residents in our communities, our neighbors. And so that's what we're here to do. We really thank you for being here today. Please take advantage of the resources that are on our website. And as Chuck said, reach out to us and to one another. And we are always here to help you. Really appreciate all of you being here. And please stay tuned for our session in December. We will be actually talking about the age-friendly ecosystem. So from age-friendly health systems, age-friendly public health systems, age-friendly communities, dementia-friendly communities, and palliative care. So we're going to try and bring that all together with a public health focus. So just thank you all so much for being here. It was good to see you. Chuck, thank you again. Jane, good to see you as well. Thanks, everyone.
Thank you.